Thank you, Ms. Harry. I acknowledge presence of Dr. Gildan S.T. Tong, Acting Chief Medical Officer and Coordinator of Home Isolation Program, Ms. Kimberly King, Destination Marketing Manager, Discovery Dominica Authority. Good evening to all. COVID-19 status update. As at November 25th, 2021, total number of new cases 45, 42 antigen positive and 3 PCR positive. Total active cases 394. Among them, COVID care complex has 235, home isolation 158, and Dominica China Friendship Hospital Isolation Unit has 1. Total recovered cases so far 5,434. Total COVID-associated deaths 37. Our vaccination coverage, 54% of the target population now took at least one dose of the vaccine, and 50% of the target population are now fully vaccinated. With respect to daily trend of COVID-19 cases, from July 28 to November 25th, 2021, number of cases are going down, but very slowly. At this stage, number of average cases per week stands at 42, a little higher than what it used to be previous week. So it remain or at steady state at this time. Let's look at the characteristics of the new cases. So distribution of the new cases by their age and sex. As you can see, among the age groups that are most affected by this COVID-19 include 18 years to 65 years age group. We also have a population less than 12 years age group. Very few, however, there are cases. And we have 65 and above years age group also affected by this COVID-19. I want to point it out, the age group 12 and 17, in my last presentation, I have noted that there were no cases, and this today, we also have one case only in this age group, which is very, as compared to what we have seen prior to month of November, average we used to see at least 5 to 6 cases. But now we are seeing between 1 to 2 maximum. In terms of their clinical presentation or in terms of their severity, we can say that 47% are symptomatic. 47% are symptomatic as compared to 33% asymptomatic. This is characteristic. This is very new phenomenon actually. Recently we are seeing more symptomatic cases than asymptomatic cases. At the beginning of this surge, I have presented that we had more mild or asymptomatic cases than symptomatic. Now we are seeing more symptomatic cases than asymptomatic. Let's look at those active cases, those who are at the COVID care complex. As of November 25th, 2021, we are seeing more female, 54% to 46% of males. And number of cases by their age group, mostly between 18 to 59 years age group. We also are seeing age group of under 18 years as well. Let's look at their clinical presentation. Most of them are mild. 68% are presenting with mild symptoms. 27% moderate who require admission at the government COVID care complex, and 5% are severe. Let's look at the positivity rate. At the beginning of this surge, we had positivity rate at about close to 9 per 100 tests conducted. Now it stands at 5 per 100 tests conducted. This is indeed a positive sign going forward. Let's look at our deaths. Total number of deaths as of November 25, 2021, 37 of them. Male 17 and female 20 of them, sorry. So their age ranges from 40 years to 107 years. Median age remain at 80 years. Most of them had comorbid condition. 97 of them persons had underlying medical conditions. And vaccination status, 35 out of 37 were unvaccinated. That is 95% were unvaccinated. So in summary, the number of daily cases are stable. However, we would like to see it go down. The positivity rate stands at 5 as of yesterday, meaning 5 positive cases in every 100 tests that were conducted. Most of the deaths were unvaccinated, 95% of them. And in 12 to 17 years age group, the number of cases are much lower than prior to November 2021. On average, we are seeing 1 to 2 cases per day since November, as opposed to 4 to 6 cases per day prior to November. Okay, here you go. Little bit of Omicron. Omicron is there. I have presented at the beginning of this surge about the Delta variant. And I have indicated that why we are seeing variants. We are seeing variants because we are allowing actually the virus to mutate within our body. The more we stay away from vaccination, the more we are allowing active virus to mutate in their own peril and become something else beside Delta. And here is, we have one already. Before we finish Delta, we have Omicron. I mean, we meaning it's on the horizon. It's somewhere in Africa and Europe. The genetic sequence include B1.1.529, that is. It was first reported to WHO from South Africa on 24th of November 2021. The infections have increased steeply, which is coinciding with the detection of this variant, Omicron. This variant has a large number of mutations, some of which are concerning. Preliminary evidence suggests an increased risk of reinfection with this variant as compared to other variant of concerns, based on the evidence presented indicative of a detrimental change in COVID-19 epidemiology. With this, I want to plead to everyone, those who are not vaccinated, please get vaccinated. Continue to wear face mask, avoid social gatherings. There is no let off of these social measures. We must continue. Keep 6 feet distance anyone other than household members. Wash and sanitize frequently. The more we do those things, even if we come in contact with any of these cases, depending on the density of the virus, meaning quantity per breath or per ingestion or inhalation of this may be low. And in essence, you might save yourself from getting infected. So all these measures are required. Once you get vaccinated, then vaccine is going to fight for you. I mean, antibodies is going to fight against the virus. If you wear the mask, then less chance that you will have that many virus in your body. Again, if you do avoid the social gatherings, you may altogether avoid getting contracted by it. And if you have the distance adequate enough that virus cannot hop on you, obviously you will not get the virus. And wash and sanitize is very important, as we have professed right from the beginning of this pandemic, that more you wash, the less virus can stick onto you. As a result, there will not be an opportunity to virus to really take over your body or replicate profusely. So with that in mind, I thank you for listening. Have a good night.
Our thanks to Dr. Ahmed, the national epidemiologist. And of course, just to go over the numbers once again, our new cases, 45, that's as of November 25th, 45 new cases. We stand at 394 active cases, 5,434 recovered cases, COVID-associated deaths here in Dominica at 37. Of course, we've seen an uptick in the number of people being vaccinated. We want to commend all those of you who have availed yourself of this opportunity. However, we're not there yet. So we continue to encourage you to get vaccinated. Visit your health center. Every type 3 health center, that's the main health center in every district, has vaccines available. This evening, we continue with the Destination Marketing Manager at the Discover Dominica Authority, Ms. Kimberly King.
Thank you, Ms. Harry. I'd like to first acknowledge Dr. Ahmed, Dr. Tang, the media, the listening and viewing public this evening. So with regards to COVID-19 that we just received from Dr. Ahmed, we do have some positive indicators. And with regards to the Discover Dominica Authority and by extension, the Ministry of Tourism, we are actually happy to announce the resumption of the ferry services to Dominica. Historically, the ferry service in the French Antilles has been very important to Dominica, where we've seen in terms of social connections, trade, tourism, etc. As I said, very significant and essential to the island because, as you know, with regards to access, with access, it means we have the ability to rebound in our numbers as it pertains to tourism. So yes, important linkages, and we would just like to reiterate with regards to the protocols, the approved protocols for entering Dominica. In summary, you require a negative PCR test taken up to 72 hours prior to arrival, a health notification of approval to travel to Dominica upon completion of the health screening questionnaire, and vaccine certificate where applicable for those vaccinated. Upon arrival, vaccinated travelers will undergo an antigen test and if negative will be medically cleared. For those that are non-vaccinated, the procedure is somewhat similar. However, they must also present a safe in nature confirmation. As we mentioned, the importance and the significance of the ferry services here to Dominica and its importance to tourism. We also want to reiterate that we are very happy to note that this is actually being done on a phased basis and will be monitored with regards to by the Ministry of Tourism and of course our health officials on the island. We all have a critical role to play, and as Dr. Ahmed just mentioned as well, with regards to the uptick in numbers with vaccination, 50% of the target population, which is positive, it means we need to continue driving those numbers up with regards to vaccination. So thank you and have a good evening.
Our thanks to Ms. Kimberly King, Destination Marketing Manager at the Discover Dominica Authority. And of course, our gratitude to the DDA and all the other stakeholders, tourism stakeholders, for implementing the measures necessary to keep travelers safe. We all know that traveling during this pandemic is not without its challenges. So we commend you on your efforts, and we commend all our other partners on their efforts for making travel as simple, if that is the word that we can use, as simple as possible during this pandemic. Again, the protocols remain the same. Ever since the borders reopened, our protocols have been PCR tests within 72 hours, no more than 72 hours before your arrival. You also have to complete the health questionnaire. You have to await the approval for travel. If you fill out the questionnaire and you're not approved for travel, that means you are not yet allowed to enter the country. Again, when you get to the airport, there are protocols to adhere to, and we plead with you to adhere to these protocols for your own safety. Finally, this evening, we welcome Dr. Gilda Nesty Tong. Dr. Tong is the Acting Chief Medical Officer, and she's also the coordinator of the Home Isolation Program.
Dr. Shaluddin Ahmed, National Epidemiologist, Kimberly King, Destination Marketing Manager, Discover Dominica Authority, and our very own Sheena Harry, our Communications Specialist. Ladies and gentlemen, good evening. As of today, the 26th of November, 2021, globally, there have been in excess of 259 million confirmed cases of COVID-19. With a documented 5,183,000 deaths reported to the World Health Organization. As per our esteemed national epidemiologists, the COVID-19 cases in Dominica remains somewhat stable, with confirmed number of deaths already indicated as 37, which for our small island state is indeed too many. On behalf of the Ministry of Health, Wellness and New Health Investments, and myself, I would like to use this opportunity to extend deepest condolences to all family and friends who have lost someone to this dreaded virus. Ladies and gentlemen, COVID-19 is real. It is ever present, and it continues to cause havoc on our nation. The only way to combat this virus is to, first of all, get vaccinated. Vaccines allow your immune system to have a preview of the virus, so that in the event that you are truly exposed to COVID-19, your immune system is placed at an advantage to fight the disease. One may think that they are safe after having been infected with COVID-19 and that the vaccine is not important at this time. However, according to the World Health Organization, and I quote, "Even if you have already had COVID-19, you should be vaccinated when it is offered to you. The protection that someone gains from having COVID-19 will vary greatly from person to person. The immunity people get from being vaccinated after having a natural infection is consistently very strong. Getting vaccinated, even if you have had COVID-19, means you are more likely to be protected and for a longer period of time." In addition to the health benefits of being vaccinated, according to the protocols of the Ministry of Health, any asymptomatic, fully vaccinated individual is allowed to isolate at their homes. As of the 25th of November 2021, there have been a few more cases than mentioned by Dr. Ahmed. We actually have 177 persons in home isolation. Being afforded that privilege, you are expected to remain home and not congregate with other family members or venture from the home. As a matter of fact, this is a breach of the protocols of the Ministry of Health and a breach of the statutory rules and regulations of the Commonwealth of Dominica. Again, ladies and gentlemen, Persons in home isolation are supposed to be asymptomatic, not symptomatic. They are supposed to have a red band placed on the wrist indicating their positive status. Too many persons are using crafty means to venture from the home when in home isolation. If asymptomatic, the band is placed on your hand and should be kept on your hand for the duration of your isolation period, which is 10 24-hour days. The band is then removed by the staff at the home isolation unit or the district nurse on day 11. Family members who visit with and mingle with the home isolated patient ultimately puts themselves and the general population at risk. As a matter of fact, immediate family members of persons in home isolation are considered primary contacts and should quarantine within the home and should be tested on day 5 of that quarantine period. All symptomatic, vaccinated, COVID positive patients are to be admitted at the COVID care complex, where close monitoring is done so as to detect worsening symptoms, if any. If a patient is COVID positive, asymptomatic, and fully vaccinated, but unable to isolate at home without putting other family members at risk, that person too should be isolated at a suitable COVID care complex in Portsmouth. Ladies and gentlemen, to flatten our COVID-19 curve or to help reduce the number of positive cases on island, you have to be your brother's keeper. If you witness someone breaking the rules of home isolation, please report it. Contact your district nurse. Contact the home isolation unit. Contact the police. We all have to work together to put an end to the spread of this virus. In addition to getting vaccinated, the Ministry of Health further reiterates the usual, the importance of exercising all necessary COVID-19 precautionary measures. Rest assured that now is not the time to drop our guard. At this time, it is even more important that we wear our masks properly. Soon, we will be experiencing a rapid influx of nationals and non-nationals on our shores. With the resumption of our ferries, the impending increase in American airline flights to our country, and with the upcoming festive season, we have to be even more careful in our practices. Remember the need for repeated washing of hands, social distancing, and the importance of avoiding large super spreader events or large crowds. Do not be held accountable for bringing the virus home, infecting undeserving family members, or even leading to their ultimate demise. Together, ladies and gentlemen, if we work together, we can overcome this pandemic and all its obvious inconveniences. Thank you very much and have a good night.
And our thanks to Dr. Gilda Nesty-Tong, who is the Acting Chief Medical Officer and Coordinator of the Home Isolation Program. Again, Dr. Tong stressed the importance of remaining home when you've been asked to do so. You do yourself and your family and the entire community a disservice if you try to beat the system, so to speak, hide your bands and escape home isolation. It is an act of love if you follow the protocols, every protocol. Ladies and gentlemen, as always, we encourage you to get vaccinated. We can't stress that enough. That is our best line of defense against this virus. Avail yourself of these opportunities. We thank you always for your attention. We thank you for your patience. We remind you that the COVID hotline is available to you 24 hours a day should you have any questions or concerns. We wish you all a pleasant evening and have a great weekend.
Hi guys, my name is Adam Ford from Adam Songs. Honestly, it was a bit hard to come in and decided to take the vaccine. But when I think of everyone else and I think of the entertainment industry, I just have to decide, you know what, let me just take that chance and make that decision. So I just want to encourage everyone, that for some reason they want things to get back to normalcy, for whatever reason, I think they should take that chance and make that choice also.
Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Rush. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Bruna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine.
I think this is definitely the way so we can make it, so things can go back to normal,
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be one of the first people to get a new vaccine.
I'm a little nervous, but kind of excited at the same time.
I'm going to take my COVID-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't like injection.
I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important.